Okay, so you've maybe wondered what really goes on in therapy training. I mean, beyond the textbooks and the theories.
Yeah, what does it actually take to
Yeah,
become someone who can genuinely help people through, well, really tough stuff?
exactly. That's what we're getting into today. We've looked at some material that paints a much more grounded picture, I think,
Yeah.
about what learning to be a therapist is really like. Our goal here is to uncover those authentic realities, the stuff that maybe doesn't always make it into the formal curriculum.
And a core theme that just jumps out is this difference, this like gap between the theoretical training and the actual messy reality of the consulting room.
Right. So our sources really seem to hit on that point pretty hard that traditional training, it's foundational, sure, but maybe leaves some things out, things you only get through, well, experience.
Definitely. It makes you ask, what are those missing pieces? Like you
Yeah.
learn diagnostic criteria, treatment plans,
The technical skills.
the technical skills exactly, but maybe less time on, say, building real empathy in the moment or managing your own reactions when things get intense. That kind of experiential learning.
Okay, yeah, let's unpack that. The sources we saw really highlight a couple of key qualities. Authenticity, for one,
Mm.
and being grounded.
Yeah.
It's not just about knowing what to do, but about, like, showing up as a genuine person, but also stable, right?
Precisely. Which suggests that good therapy isn't just a set of techniques you deploy. It's deeply connected to who the therapist is.
How so?
Well, authenticity helps build that real connection, that trust. And being grounded, staying steady, aware of your own stuff, not getting swept away by the client's pain.
Like a tree in a storm, sort of.
Exactly like that. That provides the stability the client needs. It's essential.
Okay, here's something that really stood out. One source used this really vivid phrase. It described the therapist's job as sitting in the shit with the client
Hmm.
without taking on their pain or injustice. That just hits hard. It's about being fully present with someone's worst struggles, but somehow not absorbing it all.
Yes. And that gets right to the heart of boundaries and maybe a specific kind of empathy.
How do you even learn that emotional resilience?
Well, it's about developing this capacity, this ability to hold space for what the client is feeling, but crucially, maintaining a clear sense of your own separate experience, your reality versus theirs.
Keeping that distinction clear.
Super clear. It's vital for the therapist's own well-being, obviously, but also so they can actually help effectively stay objective.
So fundamentally, it's knowing I am me, you are you. We're in this together right now, but we are separate individuals with our own feelings.
That's it. Sounds simple, maybe, but it feels like something that really deepens over time with actual practice.
I bet.
And knowing that separateness. That's what allows the therapist to provide what one source called a buffering space. What does that term bring up for you?
Buffering space. Makes me think of like a safe zone, a comfortable container, maybe. Even when the stuff being talked about is really uncomfortable.
Yeah.
A place where the client feels secure enough to actually go there, explore those tough emotions, maybe try seeing things differently.
That's a great way to put it. It's not about shielding the client from the discomfort.
Yeah.
Not at all.
Right.
It's about creating a container for it. A safe place where that discomfort can be felt, looked at, processed without it being overwhelming.
Okay.
And the whole point, as the sources really underline, is facilitating the client's own growth, their healing. They do the work, but within that secure space, the therapist helps create.
So pulling it all together, what therapy is really about based on this seems to be bringing your authentic self, staying grounded, and creating this safe haven.
This buffering space.
Yeah, this buffering space for clients to navigate the hard stuff and grow, even if, the academic side doesn't always fully capture how vital these things are.
That sums it up well. And it leaves us with a thought, doesn't it? Formal training gives you the start, the framework,
The foundation.
the foundation.
Huh.
But developing these qualities, the authenticity, the groundedness, the skill to hold that space that seems like a lifelong journey for a therapist. It happens way beyond the classroom.
Absolutely. So for you listening, maybe think about this. How do we, just in our everyday lives, create those kinds of buffering spaces for people we care about? And what does it really take to sit with someone else's difficulty without getting completely pulled in?
Good question. It suggests that kind of ongoing self-awareness and growth isn't just for therapists, is it?
Seems like it's key for all of us, just trying to navigate human connection.